Hello everyone, welcome to today's lesson with Caleb Mulonga. Today we are looking at nursing care plan for nephrotic syndrome. So as you know, nephrotic syndrome is a condition that we find in the renal system, specifically the kidneys, in which there is damage to the glomerular membrane basement. So there in that condition, you find that because of the damage to that membrane, there are several factors, there are several things that will happen as a result of that. So today we are looking at how we can manage it as nurses. And in this video, we are going to make sure that we talk about at least minimum of 5 problems that we can find and others that we can also find in this condition. We will discuss all that. Before we go any further, I ask of you to subscribe to our YouTube channel, like, comment, and share our videos. Okay, let's dive into it then. So as we have been saying, as I have said, that nephrotic syndrome basically is a condition that affects the renal system, specifically the glomerular basement membrane. Okay, so in that membrane, you find that during our assessment, there will be edema. So one of the signs and symptoms in this condition is that there is edema. So in that edema, you find that that edema can also cause what we call pulmonary edema. It can lead to pulmonary edema. And as we all know, when there is pulmonary edema, there will be difficulties in breathing. So that is why our problem is altered breathing pattern. That is where the altered breathing pattern is coming from. So our problem is altered breathing pattern. Nursing diagnosis. Nursing diagnosis is altered breathing pattern due to pulmonary edema, evidenced by labored breathing. So as you know, we have stated the cause and how we have seen where this altered breathing pattern is coming from and how we have seen it in this patient. Then we move to the goal. The goal is to improve the breathing pattern within 30 minutes of hospitalization. Interventions. I will check the breathing pattern per minute for baseline data. So basically, those are the respirations per minute for baseline data. Number 2, I will nurse the patient in a semi-Fowler's position to promote lung expansion. Number 3, I will assess the oxygen saturations using a pulse oximeter to monitor blood gases. And number 4, we can say I will administer oxygen to improve tissue oxygenation and perfusion. So as you have seen from the interventions that we have put up, they are all addressing the breathing pattern. All of these are addressing the breathing pattern and improving it so that the patient can breathe better. Evaluation. The patient's breathing pattern is normal throughout hospitalization, evidenced by respirations within the normal range. So depending on the age of the patient, specifically if it is a child, you know the ranges. So we can put the ranges, but this is a general one, meaning we are not specifically saying it's for children or for adults. But mainly if it's in children, we understand that it's 20 to 24 respirations, while in adults we find that it's 18 to 16 rather to somewhere 18 to 20. So that is our first problem. Our second problem is imbalanced nutritional status, less than body requirements. Where is this coming from? It is because there's anorexia in this patient, and also you find that there is impaired absorption, which can be due to anasaka, which can be due to ascites rather. So our nursing diagnosis is imbalanced nutritional status, less than body requirements due to anorexia, and ascites with impaired absorption, evidenced by weakness and pale, dry skin. So we are saying the reason why this patient has less nutrients in the body, it is because of the poor absorption and also due to the lack of appetite. And in this patient, you cannot say weight gain because this patient is gaining a lot of weight as a result of fluid, uh, as a result of edema and asaka that is in this patient. So you cannot say weight gain or weight loss. We move to the goal. The goal is to improve nutritional status throughout hospitalization. So remember, the goal has to be SMART. Let's look at the interventions. Number one, I will provide small frequent feeds to promote appetite once condition improves. Okay. I will offer oral hygiene regularly to help reduce metallic taste and therefore improve appetite. Number three, I will restrict salt intake by the patient to prevent fluid overload. So the diet that we are giving in this patient is a sodium restricted diet, or what we call a low sodium diet. Number four, I will offer normal protein diet to improve serum protein levels and therefore promote nutrition. Number five, I'll provide a balanced diet that will provide all necessary nutrients to promote a good nutritional status. So on nutrition, you have plenty of points, as you can see from the video, but I will not go through all of them. I have just chosen few points that I would include in my video. So all those are addressing the fact that the patient has a poor nutrition. Evaluation. The patient's nutritional status has been improved throughout hospitalization, evidenced by patient reporting having strength and a healthy looking skin. So remember, in this patient, there is nothing like weight gain as an evidence. No. And if it is in a child, you find that the child will be active because they have strength now. The child won't tell you that they are strong, but they will show you through activity. They will be more mobile and all that. Number three, the third problem is coming from a part where we understand that due to impaired glomerular filtration, there's a lot of excretion of essential proteins. So that's why you find that there is proteinuria and all that. But also, one thing that you find is that there will be tissue perfusion as a result of the reduced renal function. So because of the poor renal function, you find that there will be reduced oxygen supply to tissues. There will be reduced nutrient supply to tissues, and that is why this child will be feeling fatigue. There will be fatigue in this patient or in this child. Therefore, we can use a problem we are calling activity intolerance. So nursing diagnosis, activity intolerance due to reduced tissue perfusion, secondary to reduced renal function, evidenced by patient being extremely tired after performing an activity. So to be specific, you can say after performing an activity of daily living, so that maybe it does not sound too general. The goal. Our goal is to improve tolerance to activity throughout hospitalization. We want to ensure that our patient is more tolerant to activities. Let us look at some of the interventions that we can put up. Firstly, we have to put this patient on bed rest. So I'll put the patient on bed rest to reduce activity, as this reduces oxygen needs of the body. Number two, I will do my nursing procedures collectively or in block to allow the patients to rest. Number three, I will gradually introduce passive exercise in bed to avoid exhaustion of the patient and improve on exercise and activity tolerance. Lastly, I'll gradually introduce active exercise, or you can say I will encourage the patient to ambulate as soon as the condition improves to promote tolerance to activity. Or we can put it the way we've put it in the video, which is I will gradually introduce active exercise out of bed, walking to the toilet, walking around the ward, bathing himself to encourage independence on the patient to exercise. Evaluation. Patient reports improved ability to perform required activities of daily living, evidenced by patient performing self-care activities. So that is how we can deal with our third problem. We go to our fourth problem, which is risk of pressure sore formation. So you find that in this patient, there will be risk for breaking of skin or for risk of impaired skin integrity. But I chose to go with pressure sore formation because I'm more comfortable with it. But you can also put risk of impaired skin integrity. So why is this patient's skin at risk of breaking down? It is because of the generalized edema. Because of the edema, you find that the skin can easily break. So our problem is risk of or for pressure sore formation. Our nursing diagnosis, risk for pressure sore formation due to generalized edema, which is Anasaka. Our goal is to prevent pressure sore formation throughout hospitalization. To prevent pressure sore formation throughout hospitalization. Interventions. Number one, I will assess the skin condition for any skin breakdown. Number two, I will change the patient's position 2 hourly to prevent pressure sore formation. Number three, I will change the sewed linen to prevent moisture, thereby prevent skin breakdown. And lastly, I will remove breadcrumbs or any debris on the bed of the patient to prevent irritating and breaking down the skin. So those are the goals. Evaluation. Patient has an intact skin throughout hospitalization, evidenced by absence of pressure sores. We move to our last problem. Our last problem is risk of infection or risk for infection. So you understand that in this condition, the patient has a low immunity because of the amount of proteins that are being lost. And as a result, you find that the patient will have low hemoglobin G, immunoglobulin G, that help in the protecting of the body. So risk of infection due to low immunity, which is basically as a result of urinary protein losses, which will impair the body defenses. Our goal is to prevent infection throughout hospitalization. Let us look at the intervention. Number one, I will change sewed linen to promote comfort and prevent infection. So we understand that in this patient, they will need a clean environment. So basically, you start by changing the sewed linen. Number two, I will wash hands before and after handling the patient to prevent infection. Number three, I will administer prescribed antibiotics for prophylaxis. Number four, I will ensure that all invasive procedures are avoided or performed under strict antiseptic techniques to prevent infections. So among others, we can put a lot of conditions, a lot of interventions to prevent this risk of infection. We have a number that we can put, such as ensuring that the equipment are sterilized, ensuring that the room is well dusted, and all those things, because this child or patient is at risk of infection. Let us look at our evaluation. The evaluation is patient has not experienced any signs and symptoms of infection throughout hospitalization. Then you can put an evidence, evidenced by a normal body temperature. We can put it like that. So those are our 5 problems that we have come up with. But we understand that there are a lot of other problems that can be in this condition. Okay, so let us make sure that we listen and understand and also comment. I would like to see your comments. So I want you to comment on other problems that you can find in this patient, and we'll be able to discuss them. Okay, we have come to the end of our lesson. Thank you for watching. Thank you for staying tuned. Let us make sure that we subscribe, like, and share our videos. Thank you for everything. God bless.